And the president speaking in Mpumalanga, where of course he's measuring the preparedness and the readiness then of the response to COVID-19 in that province. Let's head over to him now.
And that is a novel initiative which we truly appreciate, which I would like to see copied in other places around the country. And relief measures in terms of have also been an area of focus. They've also identified measures that they need to embark on at the economy level, and they are looking at managing various initiatives that they can have to stabilize the damaging effect that coronavirus is going to have on the economy of the province. And they are focusing on coal, focusing on mining, focusing on tourism, and a number of other subsectors of the economy. So it's been very, very good to listen to the way the Premier and the MECs and various officials are approaching COVID-19. The strategies that they've put in place are really good. And after listening to them, we went to a school. We went to Cyril School, a school which was built after 2010, and we found that the young learners are back at school, grade 12, and the protocols that Minister Motshekga and her department have put in place are being observed to the letter. We found that they've got areas where young people wash their hands, sanitization, temperature checking. They've even marked the pathways in the school where the social distancing should happen. In the classroom, the grade 12 classroom, which has about 130, has now been divided into 7 classrooms with very good social distancing. I was most impressed to see how the school organization has been realigned, and the learners are very pleased to be at school, and school governing body members were there, and the parents are pleased that the children are back at school. So that was comforting to see the measures that are being taken at the school level. And of course, the schools are still a risk area for us, but what I saw today was good, and I'm sure we're making attempts in all schools to have that type of situation. It will be testing in other areas, and then after that we came to the hospital, the Rob Ferreira Hospital. We've been very, very impressed. The CEO of the hospital took us around. Very impressed to see how they've laid out the hospital, the isolation areas, and how they've been receiving people who are positive and managing their condition for 7 to 8 days and releasing them in a stable condition. So the visit has been a really good one, and I'd like to compliment the Premier and the MECs and the mayors as well of various towns here. I think they've done extremely well under the guidance of Minister Mkhize and Deputy Minister Pasha. They've done extremely well. So this has been a very good visit, and I congratulate you.
Thank you
for the work that has been done. Very good. And they didn't ask for money, so that's very good.
Thank you, colleagues. We won't take many questions. We'll take just the 3 hands. Start here, because I also know you. Who's next? So the only 1 hand. That's good? Oh, 2, 3. Thank you.
Thank you so much, Mr. President. Governor Whittles from ENCA. The Mpumalanga province only has 4 cases of people in ICU, but in Gauteng we've seen the state hospitals reaching capacity. People finding it difficult to find beds in the ICU units. What do you think should be done about the hospitals getting full in Gauteng and Eastern Cape? And then We've seen infection numbers of 6,000 new infections and 8,000 yesterday new infections. The country is speculating that the NCC may be considering going back to a hard lockdown. Are you considering that at the moment?
Well, the rise in infection numbers is worrying. We did anticipate that we would be reaching our peak, particularly in Gauteng. We saw the numbers rising exponentially in the Western Cape. Now we are experiencing them in Gauteng and the Eastern Cape. It is obviously very concerning, but not unexpected. We did use the period of the lockdown to get ready to prepare ourselves. And of course, we need to increase the number of beds in Gauteng as well as in the Eastern Cape. And the Minister and I, Minister Mkhize and I, were talking that we actually need to have those numbers increase within the next 48 hours. We need to see more beds being put in place, and that work is already underway. I know that the Gauteng Coronavirus Command Center is meeting as we speak now. They are going to come back to us with a number of initiatives which they believe need to be taken, and we will listen to that at the National Command Center Council, and we will examine the situation in Gauteng, in the Eastern Cape, and indeed in the Western Cape very, very carefully to see how best our response can be realigned or reconfigured to deal with the situation that we face now. Of course, we did say that if the situation seems to be getting out of hand, the issue of a lockdown is not out of the question. It's a tool in our toolbox that we've used before. It served as a good purpose countrywide to flatten the curve, but we resorted to using the other tools in our toolbox, and the key one is social behavior. We've got to change the behavior of our people so that we have social distancing properly, wearing of masks, sanitation. That is now at the moment the known way in which we can avoid the rise in infections. In the absence of a vaccine, those are the tools that we need to continue using.
Newsroom Africa.
It's Mbali here, Mbali Titani from Newsroom Africa. I just want to find out from you, Mr. President, we've seen more job losses under the hard lockdown. We've seen the economy taking quite a strain. Can South Africa afford to go on once more on another hard lockdown?
Well, the issue of another hard lockdown is something that we're not considering now. Because, as I said, we're using the other tools in our toolbox. The issue of losses of jobs is a concerning one to us. The record of some 31% of our people not working concerns us as government, and we know that other countries are experiencing even bigger job losses. The United States, at one stage, 26 million people out of work, almost within a short space of time. We are developing various ways of responding to the jobs that are being lost. When we move to the various other levels, including level 3, we were responding to trying to stem the job losses that could ensue out of a hard lockdown. And what we've been seeking to do is to balance the lives, saving lives of our people, and also preserving livelihoods. And it's a delicate balance, and we will continue on this path because we cannot do one at the expense of the other. And so far, we've been doing that delicate balance, and we will continue to save jobs, but we also want to create more jobs as we move on.
SABC.
Sipepile Gunene from the SABC. I just take from Bali a bit. With these job losses happening, there's a cluster of people that were supposed to benefit from the 350 or the UIF, but unfortunately, employers did not give them their money. What happens to them now? Because some of them are contemplating suicide. I've been getting a lot of letters and inboxes on that. What happens to those? Because now they are desperate. Secondly, with the beds that are being filled in other provinces, is there a possibility where we will see one province asking for another to help transferring patients from one province to another? Sorry, where they don't have much.
Well, I'm going to ask Minister Mkhize to answer. He's the hospital man. he's my hospital expert. But in relation to the first question on the issue of employers who have claimed UIF money from the UIF fund, the unemployment insurance fund rather, and not paid back to workers, we are concerned about that. And I've asked the minister and his officials to look very closely at this, because it is just plainly wrong for an employer to apply for unemployment insurance and then not pass on that money to the people for whom the unemployment insurance is meant for. Unemployment insurance is not meant for employers. It is meant for the workers who get into a situation of being either retrenched or unemployed or some form of distress. So we will be looking very closely at that, and we want to investigate that very closely. And those employers who have done that are going to find themselves in real hot water when it comes to the government on an issue that is as fundamental as that to the livelihood of workers. Dr. Mkhize will answer the other one of hospitals, people being moved to other hospitals.
No, thank you very much, President. I think the response that you've already given is really what will happen, and that is for every area where there's a problem of additional beds needed, we will provide in that area. So the 48 hours the President is talking about, in some instances, it means we'll have to put up marquees and have That's what actually is going on right now in Gauteng. We are therefore, taking the additional proposals that will come from Gauteng, and then we see how to assist. The only situation where it's likely that you might have people moving from one province to another can only happen if they are nearby districts where we feel that the higher level service is in a hospital in a nearby district, like in the area of Northern Cape and some of the areas maybe in Mpumalanga, where nearby there's a bigger hospital in the proximity, and you can do that. But by and large, we have gotten a focus for all provinces to say how many beds do they need. We'll try and provide them within that area, within that district. So there wouldn't be a huge movement of people across provinces. It will just be on a situation where we have designated a higher level service to be in a nearby district or nearby province because of the proximity.
Thank you. Colleagues, thank you. Thank you very much. Thank you, President.
Thank you. There's no other channel, is there?
No, there are three.
Remember, I wanted to have my own channel.
Thank you.
So,